think the way we try to approach it is from a couple different ways. You mentioned one is certainly first and foremost, how can we continuously improve access and safety and quality for our patients? It's certainly one avenue of technology. And then you actually hit on another very important one, which is our team members. And how can we focus on technology solutions that help them? And so I'll give you a few examples. And as you know, I mean, technology is certainly pervasive and continuing to grow throughout our industry. But when it comes to care, Novant Health was the first health system in North Carolina to implement advanced technology around detecting and treating strokes. And so we've implemented this technology in our emergency departments so we can identify strokes sooner and treat them sooner, as well as really creating a very extensive telestroke network, especially into our rural communities, and being able to provide those services where they're needed and not just in our tertiary centers. And so specifically, on some numbers with stroke care, we actually, through that telestroke network and being able to have neurologists into some of our rural providers, we've been able to prevent 92% of transfers for strokes from those rural hospitals. Being able to diagnose it, treat them there, saving that transfer expense, as well as that additional burden on families having to travel out of town to a larger city for that care. We've also seen 90% of our stroke patients being diagnosed through teleneurology. We're able to be right there at the bedside without having to have a provider there at every bedside, and being able to provide that additional care. Another way is leveraging virtual care. And so certainly in the traditional ways you would think about, right? Virtual visits and that type of thing. But I want to give you a unique example. So you may be familiar recently here in North Carolina, especially Western North Carolina, we had Hurricane Helene, extremely devastating. Novant Health was the first health system there in Western North Carolina responding to the needs of that community and caring for the communities in Western North Carolina. Well, as you know, most of Western North Carolina was inaccessible. So we were able to get to some places physically, but we were able to get to every place 24/7 virtually. And so we were able to provide free 24/7 virtual care in the aftermath of Hurricane Helene, and we were able to treat hundreds of patients through that technology. And so you're really finding, I think, unique and innovative ways to leverage technology. Certainly AI and automation and all that is certainly starting to grow and evolve. We are finding ways, whether that is through ambient listening, whether it's through coding and revenue cycles, so both clinical and non-clinical ways to leverage that as well. And then you mentioned our team members. Certainly some of the technologies for treating our patients, but specifically focusing on our team members and using technology and online resources and apps for their well-being and taking care of them as well.